One of the biggest mistakes I see other healthcare providers, physical therapists included, make when it comes to treating the shoulder is not appreciating how complex this joint really is. The shoulder is the most mobile joint in our entire body, which is a great thing. It allows us to interact with the environment, to reach, to throw, do all these things that help make us human. But when it is so mobile, it also gives us many, many ways that we can compensate when things aren't moving as well as maybe we would like. So when it comes to the shoulder, we can't just treat and just focus on the ball on socket or golf ball on golf tee, which is more like it, that the shoulder is. We have to look at all the things that influence how the shoulder functions and allow it to do its job. So we need to start with the foundation of what the shoulder is. Let's look at the golf tee of the shoulder, right? So if we think of the ball of the shoulder being a golf ball, the golf tee is what it sits on, right? So what does the tee actually compose of? Well, the tee is part of the scapula of the shoulder blade. And the shoulder blade is a fixed bone, right? It's shaped like this, kind of like a little curved shape. And it's shaped that way and should sit on the rib cage that is hopefully a similar shape, because that allows then it to feel nice and supported and secure. It means the muscles that then attach to the shoulder blade and to the rib cage itself and to the ball of the shoulder, everything in that area, can really just focus on doing its job. If that shoulder blade does not feel that it is supported well on the rib cage, maybe it feels like it's floating in space a little bit, well, then we'll get some of that tightness and those other sensations that we feel, those muscles in our upper back, for example, because it's now having to do double duty. It's having to do its job and also feels like it has to provide some stability that maybe it's not getting because that shoulder blade isn't sitting nicely on the rib cage underneath. And one exercise that I've done with many of my patients to help get that rib cage to support that shoulder blade nicely is a drill where we put our forearms on the wall, like in this video here. And as you can see in the demonstration, I'm trying to get a straight line from my wrist to my elbows. I'm almost rotating my wrists outwardly, almost externally rotating at my shoulders, which should help me feel the back of the shoulders working a little bit. Now, you'll really get it when we focus on the key of the exercise, which is moving the rib cage back into the shoulder blade itself. We do this by pretending, the cue I like to give with a lot of my patients is pretending that my thumb is a hot poker, and I'll put the poker right in front of the sternum, the chest bone, and I'll cue people to move away from that hot poker. So imagine you're pulling away from something in the front of the sternum, in front of the chest bone. You should feel a stretch through the armpits itself. You might feel those armpits working a little bit. Those are muscles called our serratus anterior that do a lot of important stuff for us. So this is an example of a drill that can get the back of the shoulders working a little bit and also, again, move that rib cage into the shoulder blades itself. The key is we're not hunching over here, and if we hunch over, we'll end up hitting that hot poker in front of us. That's an easy way to keep that in mind. And now, assuming that we've done a bunch of drills, exercises, etc., to work on achieving a really good position of the rib cage itself to therefore support the scapula, the shoulder blade, we now can say, hey, scapula, hey, shoulder blade, it's time for you to also do your job because you have the support now to do so. And when we move our arms, whether it's moving overhead or out to the side, etc., your shoulder blades have to be able to move away from midline and will almost rotate upwardly. If you watch somebody and let's say when they reach their arm overhead like this and you're standing behind them, assuming you can see what's happening underneath their shirt, you'll see the shoulder blades rotating up and rotating down. That's very important. You'd be surprised at how many high-level athletes we see where their shoulder blade mobility is limited, which therefore puts a lot more stress on the shoulder, the ball on socket, golf ball on golf tee itself. One drill that we can give that's pretty simple to you to do at home to work on that, what we call scapular or shoulder blade upward rotation, the rotation we need to have for your arms to get overhead, is a down dog exercise. A lot of us have probably seen that, right? We're starting in a push-up position, then we're driving and pushing through our hands to drive our chest towards our knees. And the big thing I'll cue to a lot of my patients is I'll tell them to imagine you're pushing away from the floor to engage and drive those shoulder blades outward, almost feeling like the bottom of that shoulder blade is coming towards halfway down or almost like the midpoint of like our trunk here. And that's an example of an exercise now we can do to get the shoulder blades moving. So we got the rib cage positioning, we're focusing on getting the shoulders moving, and then finally we can go towards some of those more traditional rotator cuff or shoulder exercises that maybe we've seen before, and that then allows them to be most effective. What is the take-home message here? Well, the message is that shoulder pain is complex. There are many different reasons why somebody may have shoulder pain and chronic shoulder issues in the first place, and therefore there are many different avenues we can go to be able to address that. So if you have gotten treated for your shoulder issue before and maybe it hasn't been super successful, or you've been dealing with shoulder problems for years and it's really important for you to be active and you have many different things you want to be able to do, but your shoulder's just limiting you and it's getting pretty frustrating at this point, there is no reason to get discouraged because there's so many areas we can attack to be able to get you back to a level that you are happy with. So if that's something you're interested in, don't wait, contact us today because we would love to be able to help you.